Exploration into Alzheimer's dementia, an approach to modeling neurological conditions. An overview of this presentation will be first to go into what is Alzheimer's, then to show a clip of the brain simulation I created, then discuss the initial approach I had, some software complications, and then discuss current treatment plans and ones that are to come in the future. So the goal of the project was to realistically model the human brain using 3D rendering software and show how certain disorders, such as Alzheimer's disease in particular, can impact this organ, as well as look into treatment options that exist and explore other potential routes that will be developed in the near future. Simply put, Alzheimer's disease is a neurodegenerative condition that can be diagnosed along a spectrum, such that there can be individuals with a more aggressive version of the disease who may end up functionally dependent, whereas there are other individuals who are maybe in their earlier stages and may just be suffering from early memory changes for now. It is the most common form of dementia that tends to show symptoms in later stages of one's life. It is the most common form, and a widely believed theory currently, simply put, is that it may be caused by depositing of proteins, such as amyloid, which forms plaques there, or other proteins such as tau, which actually forms tangles of or around the brain cells. This thus causes the death and injury of healthy neurons and eventually the shrinking of the human brain. This is called cerebral atrophy, which is basically the loss of neurons where the connections that help to transmit information are deteriorated as a direct consequence. This is the aspect I specifically wanted to model. As you can see in these diagrams, you can compare what a normal human brain looks like versus how Alzheimer's disease affects the brain. In the more cartoonish diagram, you can see how there's like normal neurons versus those that have amyloid plaques or that are tangled. And you can also see how the hippocampus had shrunk, which is responsible for memory, and even the cortical shrunk. Then with the diagram of the actual realistic human brain, you can compare how it looks like in real life, an individual with a healthy human brain versus one who has suffered from Alzheimer's. And with the third diagram, which is more cartoonish as well, you can compare how it progresses, so it shows that there's a spectrum. The symptoms of this disease vary on a spectrum where there are different ones for early stages versus later stages. For instance, for early stages, you can have mild cognitive impairment, which begins in the medial temporal lobe, and some symptoms could be just short-term memory loss. Then in milder Alzheimer's, this can spread to the lateral and parietal lobes and can lead to reading problems, poor object recognition, and poor direction sense. In moderate Alzheimer's, you can have this disease spreading to the frontal lobe, where symptoms would include poor judgment, impulsivity, and short attention. And then in severe Alzheimer's, it can lead to the spread to the occipital lobe, and symptoms can include visual problems. Now, what are some risk factors? Some include diabetes, midlife obesity, smoking, depression, physical inactivity, and midlife hypertension. Hypertension is another word for high blood pressure. It's also important to note that this usually happens to an individual in their later stages of life, so when they're older. As you can see by this graph, you can compare how it's actually increasing very drastically in even males, females, and overall you can see this trend as well. There are over 121,404 deaths that occurred in 2017 just due to Alzheimer's, and notably there's been a 31% increase from 2000 to 2017 for people aged 65 to 74, and then from the age group of 75 to 84 there's been a 57% increase. Here I show my simulation, the clip I had made of a healthy human's brain versus how Alzheimer's thus affects this. My original plan was to model a realistic representation of how the neurons deteriorate due to the plaque buildup and how the neurofibrillary tangles, which thus leads to the loss of connections and eventually cerebral atrophy. However, due to difficulties with exploring the software, I was only able to create a rough representation of a healthy human brain shrinking. How it worked. So first, I planned to use 3D rendering software such as ZBrush or Blender, and because I had bit of previous experience with Blender, I was more comfortable with using it as a model. At first, I had planned on using the basic, almost cartoon-like shape of the brain, and I had found model images of the brain that had dimension descriptions that were meant to reflect the average measurements for an adult human brain. Based on these dimensions, I was planning on creating a model that could accurately reflect different sections of the brain, especially ratio-wise in terms of sizes of different sections. So after I had created the basic shape, I started adding smaller details, such as, for instance, the different sections of the brain, such as the stem versus separation of the left and right hemispheres of the brain. Then I moved on to create a minimalist backdrop as to avoid creating distractions from the model itself. I started working on the folds and the grooves of the brain based on images and videos of dissections. In order to create these grooves and folds, I had to use cylindrical tubes since there is no actual tool on the software for creating grooves and folds. And I used these cylindrical tubes I stretched out and removed the ends from in order to represent it. Then I moved on to work on the shrinkage of the brain due to Alzheimer's. And after that, I worked on the animation keys such as rotation the camera around the brain to be able to give different perspectives. After all that, I added color to different parts of the model. Then I moved on to making sure the camera rotating around the shrinking and the normal brain overlapped should show a progression of the disorder in order to help reflect that this is something that happens over time, it's progressive, and that it's along a spectrum. I did a couple of test renders in order to make sure the simulation had run successfully. Then I began the final render, which took about 13 hours to be completed. So what were the struggles I had with the software? Well, some issues with using a software such as Blender in order to create models is that as a beginner, there are numerous different commands and tools that first need to be learned and practiced with in order to be able to efficiently use the software. As a beginner, I had to follow numerous tutorials with objects completely unrelated to brain in order to practice, like donut tutorials, and then I had to learn to apply these techniques learned in order to make the brain. I had originally planned to also simulate how neurons on the microscopic level are more directly impacted by Alzheimer's versus healthy neurons. But due to struggles with even a more basic model using the software, I was unable to do so, and hence unable to show how neuron communication is affected. I was also unable to achieve the level of accuracy that I originally planned on issuing in terms of representing the grooves and folds of the brain and even the stem, which made the model look almost cartoonish, which is not what I had intended. Current treatment plans for Alzheimer's dementia. Currently, there is no treatment plan that could stop Alzheimer's dementia, but they are being extensively researched as this disorder is recognized for the impact it can have in the lives of numerous elderly individuals, especially those over the age of 60. There are currently treatment plans set up to help manage and suppress symptoms, so there are symptomatic treatments in the present day and age. For instance, there are cholinesterase inhibitors, and this drug works to bind and inactivate cholinesterases in order to reduce the normal level of degradation of acetylcholine molecules. Acetylcholine is an important molecule as it plays an important role in neuron communication. It helps to promote an action potential as it is released into synaptic space. So since Alzheimer's works to deteriorate neuron communication, this drug helps by keeping more of the molecules that help in relaying messages in the brain functional. However, the issue with this drug is that it also increases acetylcholine in places where we do not necessarily want more of it, such as in the peripheral nervous system, which can lead to side effects like nausea and even muscular weakness. It is also important to note that in clinical trials, there were also some patients who were not affected at all, either in a positive or negative way, with the use of this drug as compared to a placebo group. So what is the future of Alzheimer's treatment? Well, there's currently a lot of research being done into other possible ways that neurons may play a role in the advancement of Alzheimer's, such as hyperforylation, neuroinflammation, and oxidative stress, in order to look into other ways to target this urgently incurable illness. There is also extensive research being done to help understand how this disorder progresses to the point of dementia with the use of biomarkers. One theory that is being explored is since in order to maintain proper brain functions, there needs to be a proper balance of sphingolipids, which work to protect cell surfaces against external harmful factors in the plasma membrane. They want to explore the use of sphingolipids as a biomarker for Alzheimer's dementia, as this balance can be monitored. These biomarkers play an important role in being able to track the progression while still being minimally invasive in order to help detect Alzheimer's dementia early on. It is important to note that there is also research being done into developing patient-specific biomarker profiles, as there are numerous pathways that can play a role, and hence more individualized treatment plans are necessary. Being able to monitor individuals early on who are at risk can also help with planning and researching to help with other clinical trials that correlate directly to the inhibition of the early progression of Alzheimer's. Thank you for listening.